today's video is very interesting. Why means in today's topic or video, we will learn how to use your CPT coding book. If you are new and wants to enter into medical coding, and if you want to understand what is the purpose of each and every CPT code, please watch this video until the end. If you are experienced coder, it will become a refresher for you. So today's our topic is CPT code journey from check-in to discharge. As most of the coders are aware of CPT codes, but they don't know what is the purpose of each and every CPT code we will use during the patient journey. In CPT book, we have CPT codes based on check-in to discharge. So these are the sections, range and description. So we have first section 0 series. So we will use 0 series for anesthesia. So most of the time this 0 series we will use for procedures involving anesthesia. So anesthesia coders most of the time use these 0 series codes. Next we have 1 to 6 series. These are the most commonly used CPT codes for surgery. So surgery coders mostly use 1 to 6 series. Next we have 7 series. So as most of the people know, 7 series is for radiology. And here patient will perform imaging and diagnostic test. Most of the time these radiology codes will be used by radiology coders. Next one is 8 series. So this will be comes under pathology and labs. So here using the 8 series codes, you will do laboratory and pathology test, and the people who will use these codes are pathology coders. And last series 9 series, as most of the people know, we will use 9 series for medicine and E&M. Most of the time 9 series will be used by surgery coders as well as E&M coders. And also, if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. So group link is the description of this video. And also, if anyone looking for same day surgery coding training, 1 to 6 series, IVR training, orthopedic surgery training, SEC training, please send WhatsApp message to 707-526-3939. So here we will understand each and every CPT code based on one scenario. Okay, so here our scenario is a 69-year-old female patient arrives with left lower quadrant abdominal pain. So using this scenario, we can understand how CPT codes appear in one real-time patient case. So here we have step 1, evaluation and management. Okay, so based on previous scenario, patient has abdominal pain and she came into emergency department, where we will use 9 series code, usually 99283 based on patient status, where during the emergency department visit, physician will evaluate patient symptoms, history as well as he will perform the initial exam. In step 2, based on the patient symptoms and conversation with the patient, physician will order for initial labs. Okay, so where we will use 80,047 basic metabolic panel as well as 85025 CBC with differential. These are very few 8 series codes. So based on patient's condition and symptoms, physician may order more labs. So the purpose of this 8000 series code is to identify the infection, inflammation and any abnormalities related to the patient's condition or patient symptoms. Step 3, imaging. So here imaging we will use 70,000 series like 74177 CT abdomen pelvis with contrast. So what is the purpose of this code? So it will confirm the cause of pain. Yes, patient is having the abdominal pain. So step 4, surgery. So based on step 1, 2, 3, physician will perform or decide surgery. So if the patient decides to perform the surgery because of patient's abdominal pain during the radiology procedure or imaging, physician has identified patient has acute appendicitis. So he wants to perform the surgery. So and physician has decided to remove patient's inflamed appendix. So usually we will call it as appendectomy. And here physician has decided to perform laparoscopic appendectomy where we will use 44970. So what is the purpose of this code? Surgical removal of inflamed appendix. Step 5, anesthesia. So during the surgery, physician will use the anesthesia. For anesthesia, we will use 00840 anesthesia for lower abdominal procedures. So this anesthesia will be used by the physician throughout the surgery. So most of the time this anesthesia coding will be done by anesthesia coders. Next step 6, pathology. So here we will use 88304 for surgical pathology and gross and macroscopic exam. So what is the purpose of this? So physician will confirm patient's diagnosis using the specimen analysis. So most of the time whenever physician perform any type of excision, it is mandatory to send patient's tissue sample to the surgical pathology. If the physician removes the fluid, he will send fluid samples to the cytology. So as physician has removed the appendix here, physician needs to send surgical pathology to the tissue sample. Step 7, recovery. So where we will use 96,374 for IV push medication and 99231 subsequent hospital care. So most of the time this 9000 series we will use for medication administration as well as monitoring. So this 96,000 series and 99,000 series are very few codes, but based on patient's condition, these may differ. So here last step or step 80 is the discharge. So here we will use hospital discharge day management E&M codes. So here during the hospital discharge day management, evaluation management, physician will manage discharge instructions as well as follow up related to the patient's surgery. So in this way, each and every CPT code is having purpose. So in the documentation, if you see 120 series codes, you need to understand what is the purpose of each and every CPT code. I hope you can understand now what is the purpose of each and every CPT code. If you have any comments or any suggestions, please mention in the comment section of this video. And also thanks for watching this video, and also share this video to your friends who wants to learn CPT coding. And also if anyone looking for surgery, SEC or any other trainings, please send WhatsApp message to 707-526-3939.